Hello everyone! So we are from small group discussion B3 and in this video we will present our student project. The title is Universal Newborn Hearing Screening. So here are the members of small group discussion B3. So the first material will be presented by my college.
Hello, my name is Dewa Guptha with the last 3 digits of name 072. So right now I'm going to explain you about the background of the Universal Newborn Hearing Screening. So nowadays, hearing loss in newborn especially is one of the prevalent disabilities that likely to occur based on the data from the WHO in 2012. Hearing loss is defined as the inability of the ear to convert the mechanical energy in the term of the vibratory of the sound into the signal that transmitted by the nerve impulse thus received by our brain itself. Early detection is needed in order to make early diagnosis in order to increase the speed of the treatment itself. Universal newborn hearing screening is utilized for enabling the early identification of congenital hearing loss that covers multi-stage hearing protocol incorporate tests such as audio-acoustic emissions and auditory brainstem response. And in the end of the day, we hope that this universal newborn hearing screening can make a preventive idea in order to increase the speed of the treatment itself. That's all from me. Thank you for your time.
My name is Dewa Naraswari Mesi with 3 last digits of name 074. The problem formulation of our student projects are: how is the process of hearing development, what causes and effects of hearing loss, and how is the screening of universal newborn hearing. The objectives of our student projects are understanding the process of hearing development, understanding causes and effects of hearing loss, and understanding the screening of universal newborn hearing. The purpose of our student projects are to improve the knowledge of the writers and readers about universal newborn hearing screening and to help the health workers to manage the abnormalities of newborn hearing organ.
My name is Yuda with left digit number 083. Anatomical development of hearing organ. The ear is made up of 3 parts of different origin that function as a single unit: the inner ear, the middle ear, and the outer ear. The inner ear arises from the optic vesicle. The vesicles are divided into ventral component that form the sacral and cochlear duct, and the dorsal component that form the utricle semicular canal and endolymphatic duct. Middle ear. The middle ear, which consists of tympanic cavity and ear canal, is lined with epithelium from the endoderm, which is derived from the first pharyngeal sac. The ear canal originates from the first and second pharyngeal arc. Outer ear. The external acoustic mesh is formed from the dorsal part of the first pharyngeal column. The eardrum is composed of a layer of epithelial ectoderm at the base of the ear canal, a layer of endoderm epithelium of the tympanic cavity, and intermediate layer of connective tissue. The pinna consists of the growth of 6 mesenchyme at the dorsal end of the first and second pharynx surrounding the first pharyngeal fissure.
Hello, my name is Gregorius from Thongiratama with 3 last digit name 085. Now, I'm going to explain about the physiology of hearing. The auricle on the outer ear directs the air vibrations from moving objects into the tympanic membrane in the middle ear and ossicles to be transformed into tympanic membrane vibrations. The vibrations travel to the inner ear where they are converted into liquid vibrations to store some hydraulic energy, which stimulates the basilar membrane and the corti organ to transform the energy into the evoked potential as nerve impulses. The nerve impulses travel through the nervous system into the brain to be processed and interpreted as sound. That's all from me and thank you.
My name is Widyasari with the last digit of name is 086. I'm going to talk about Universal Newborn Hearing Screening. Universal Newborn Hearing Screening, or UNHS, is a program that identifies congenital deafness and hearing loss in newborn. There are 2 methods of UNHS, which are autoacoustic emission and auditory brainstem response. Initial screening done with autoacoustic emission before baby comes out from the hospital are 2 days and maximum is 1 month. The procedure of autoacoustic emission are: first, insert a small probe into baby's ear canal to deliver sound stimuli to the auditory system. Second, sound stimuli are transmitted from middle ear to inner ear. Third, the cochlear outer hair cells produce an active response or emission. Fourth, emission captured by a microphone in the probe and analyzed. Last, the unit screen will display pass or refer as a result. For neonatal hearing screening, two forms of autoacoustic emission are now used. First one is transient evoked autoacoustic emission and distortion product of autoacoustic emission. Difference between these two forms can be seen in table 2.1.
My name is Gede Arya Diva Dhananjaya with the last three digit of name is 075. So now I would like to explain about the EABR, Automated Auditory Brainstem Response, which is the gold standard of universal newborn hearing screening measurement that is able to cover all AE measurement weaknesses in detecting auditory brainstem pathway and the 8 nerve dysfunction. So these measurements are obtained by recording 5 neural waves labeled in wave 1 until wave 5. It responds to the 35 decibel sound stimuli by placing disposable electrodes on the baby's forehead. This is the procedures of EEBR. The first one is attachment of disposable surface electrodes to the infant's head. And the second, put the earphone on infant ears. The third, stimuli presented through earphone on both ears. And fourth, EEBR hardware measures the neural response to sound stimuli generated from the cochlea through 8 nerve until the brainstem. And the last is EEBR hardware display a pass or a refer result automatically.
My name is Aurelia Tabina Putri Wigianto with the last 3-digit name is 081. I will explain about the interpretation of UNHS. Early detection of hearing loss is widely acknowledged by us, providing children with the opportunity to acquire significantly enhanced language skills when compared to children who are diagnosed later. Children who are diagnosed with a hearing loss before the age of 6 months may not have any speech or language difficulties and develop at the same rate as their hearing peers. Prior to neonatal hearing screening, the average age at which a hearing impairment that hampers speech and language development was diagnosed was 26 months, with hearing aids being fitted at 32.2 months.
Hello, my name is Desylia Widyasari with your last digit of name 084. Right now, I'm going to explain about interpretation of universal newborn hearing screening. Depending on the method that used, there are autoacoustic emission and automatic auditory brainstem response. First, autoacoustic emission. The results of this test are divided into two categories, such as pass and refer. Pass result indicating a normal function of cochlear and outer hair cells, whereas the refer result indicating a risk of hearing loss, especially caused by impaired function of cochlear and outer hair cells. If the result is refer, the infant's caregiver will repeat the autoacoustic emission screening or obtain it by automatic auditory brainstem response. Second is automatic auditory brainstem response. There are two categories of the result for this test, including pass and fail. Pass result indicating a normal response of cochlear, auditory nerve, and brainstem, whereas the fail result indicating infant with cochlear and neuropathy. Fail result for this test will continue with more advanced evaluation with otolaryngological and audiological consultation.
My name is Indero Nanantasiono with last 3-digit name 091. The effectiveness and limitation of UNHS. The effectiveness: better receptive or expressive language and receptive or expressive vocabulary, better speech intelligibility, improved speech perception and speech production, better reading comprehension from early childhood until late adolescence. UNHS doesn't result in any significant harm to the parent of children that undergo UNHS. The limitation: does not cover specific hearing deficit in infant. The diagnosis is often delayed because of wrong reassurance by the negative testing on the first day of the children are born. UNHS does not recognize auditory neuropathy in the first screening, and UNHS has a huge number of false positive tests. Thank you.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. So hearing loss is an extremely common medical condition, progressing in incidence and severity with age. There are two causes of hearing loss in infant and children. The first one is congenital and the second one is acquired. Congenital causes present at birth or soon thereafter. Cause of permanent congenital sensorineural and mixed hearing loss are genetic causes, abnormalities of temporal bone structure, and congenital cytomegalovirus. Acquired causes occur as a child ages. Postnatal acquired causes of hearing loss can be attributed to infection, autoimmune disorders, trauma, and ototoxic medication. That's all for me. Thank you.
Baik, perkenalkan nama saya Sutedja dengan NIM akhir 080. Saya akan menjelaskan tentang effects of hearing loss on child development. Bisa kita kategorikan menjadi 4, yaitu pertama, delays in progression of receptive and expressive communication abilities, kedua, learning problems, ketiga, difficulties in communicating, dan 4, vocational options of the child. Lalu untuk specific areas that are impacted ada pertama rate of vocabulary learning yang memengaruhi pemahaman abstract words dan words of phrases yang punya multiple meanings. Kedua ada making sentences di mana anak yang mempunyai hearing loss akan mengalami kesulitan untuk memahami complex and long sentences dan passive forms atau relative clauses. Lalu ketiga ada sentence structuring, dan keempat ada academic accomplishments yang terutama pada subjek-subjek yang membutuhkan reading dan mathematics. Lalu untuk psychologicalnya, seringkali mereka akan mengalami low self-esteem atau merasa terisolasi dari kehidupan sosial, terutama di sekolah. Mungkin selanjutnya akan dilanjutkan oleh rekan saya. Terima kasih.
Hello, my name is Guptha Dharma with my last 3 digit of name is 087. Now I will present conclusion from this paper. Hearing is the process by which the ear transforms sound vibration from external environment into nerve impulse that are conveyed to the brain, where they are interpreted as sounds. So, ear has a very important role in this process. The ear is made up of 3 parts of different origin that function as a single unit: the inner ear, the outer ear, and the middle ear. Universal Newborn Hearing Screening, or UNHS, is a program that is designed to identify congenital deafness and hearing loss in newborn. There are 2 methods of UNHS, which are acoustic emission and automated auditory brainstem response. UNHS has effectiveness and weakness. Healthcare workers must notice both of it. Hearing loss is an extremely common medical condition, progressing in incidence and severity with age. Hearing loss in children is common, and if not taken seriously, it will lead to detrimental effects on speech, language, developmental, educational, and cognitive outcomes in children. Hearing loss can be caused by congenital or acquired. Thank you.
Hello, my name is Erika Luz Adiwati with your last digit name 089. And for the advice of this paper is the writers suggest further research about universal newborn hearing, specifically in conducting tests for newborn hearing deficiency that have no limitations. Writers realize that this paper is still far from perfect, and therefore suggestions and constructive criticism will be useful for the improvement of this writing. We also hope that this paper contains useful information and gives advantages for the readers. That's all from our presentation. Thank you.
Okay, that's all of our presentation. Thank you for the attention. Goodbye.